from returning to when you go to the lab, you'll pick up your blood. It'll look more like this, but in pretend lab at HLGU, our blood looks like this. And they'll give you a paper that says transfusion form. And while you're at the lab, they'll inspect the blood with you. The lab will review the patient's name, their medical record number, their blood bank ID number, which is also stated on this bracelet, but the patient won't be there. You'll have the patient's blood type and the donor type. Each blood has a unit number, which is listed right there. And you need to also review the expiration date, which this one expires on 11/15 of 18. And if compatibility tested was completed. And the lab will send you this. You'll need to carry it. You guys as students can't go pick up the blood, but because of lab rules, but the staff will go pick up the blood. You have 30 minutes to initiate the blood from the time you pick it up from the lab. And because you have blood products, you need to be wearing gloves. Now you're going to need a second nurse to witness. So I brought Miss Tate, who's the student nurse, but you need a registered nurse. Come over here, Miss Tate. And we're going to verify this blood together. Okay. Yeah, you hold that and I'm going to read. So when you come to check off, you're going to be the reader and I'll be the listener. If you ask for a second nurse, you have to ask for the second nurse. You can't assume that I am. So I'm going to tell you his Sam Rivera, and we're going to look at his bracelet, and it says Sam Rivera. It's going to say his birth date, 1/5/52, 1/5/52, and his blood bank ID number, Miss Tate, is VBAL 1567. And I'm checking his bracelet here and the blood while she has the paper. And then I have the unit number as unit number 0037077, and she says
that matches.
And the patient's B positive, and the donor is B positive. And you're going to have to be able to, when you come to check off, you're going to have to know what kind of blood Sam can receive during his check off. So they might only, if he's B positive and there's no B positive blood available, make sure you know which ones you're picking. You'll have to choose B negative, O positive, or O negative. You're also going to check the volume, which is 300, and you're going to check the expiration date, which says 11/15 of 18. Does that say 11/15 of 18?
Yep,
Yes, it does.
does.
Checking to make sure. And we went over the unit number, and I read that, and she said that was correct.
Yes.
Okay, so I'm going to come over here. I've inspected the blood. It's not leaking. I'm going to clamp my saline, and I'm going to open this blood, and I'm going to spike it, just like you would normally, like you did last time. Spike. And you're going to make sure the saline is clamped, because if it wasn't clamped and they were both open, the blood will travel up into the saline, and this will turn pink. And guess what happens on your skill check-off? What grade do you think you'll get? I think you'll get a 0. And you're going to squeeze this a little. Okay, now we can prime this. We're going to set our rate. HRH's policy says you can start it at 100 mils an hour. Your textbook says 2 mils per minute, so that would be 120 mils an hour, but I really want you to choose 100. So we're going to type in 100. Okay, and it says press run to begin delivery at new rate, run. It's a rate increase, yes. And we're going to prime our tubing. As we're priming our tubing, it'll take a while, so I'm going to show you the other way in a minute. You need to stay with the patient for the first 15 minutes as soon as it hits its arm. So I'm going to hit stop. I'm going to disconnect it from here. I'm going to do review. I'm going to change my rate to 999. And I'm going to hit OK. It's a rate increase, yes. I'm going to hit run. And I'm going to have this close to here. You can see how this is running faster and you're not waiting for all this to get to the tip. So I'm watching it very closely change from clear to pink as it's changing from clear to pink. And you just follow it along. And you're just wasting saline. You're not wasting any blood. And I like to do this over the trash can instead of their arm because you're not giving your patients a lot of extra fluid. So hit stop right when it's almost there. I don't like to give that patient all the extra fluid. And sometimes if they have a small gauge IV like a 22 or 24, you're going to blow the IV and it'll infiltrate. So I'm going to get an alcohol. I know their IV works great. And I'm going to attach it to the back up. And now I'm going to hit review. And I'm going to change my rate to 100. And I'm going to stay, I'm noticing this is going directly into the patient. And I'm going to tell Mr. Rivera, if you start to feel anything different or lightheaded, you let me know right away because we're giving you some blood. And before you give blood, any blood products, you always want to verify the correct lab values. If their hemoglobin was 12, the blood bank would question why are you giving this patient blood and probably wouldn't let you give blood. So make sure you know that. And then you're going to come over here as we started the blood. You're going to type in the patient's name, their unit number, their blood bank ID number, and that they're B positive. And then you're going to fill out the donor number and the blood type. And it says it's B positive. And then you're going to have me as the primary nurse sign and the second nurse sign. And then we're going to put our start time, the date, the time we started it, which is 10:32, and who the nurse that starts it. As a student nurse, your instructor needs to sign with you. Before you get the blood, I did forget to mention this, you need to get vital signs. So I'll put that in the comments. Get free set of transfusion signs, and then you're going to get vital signs 15 minutes into it, 30 minutes, an hour after you start it, and on completion. And you're going to put the date you completed it, the time it ends, and the volume transfused. I'm going to look at my textbook here to make sure I hit everything. And I told you the two nurses need to check it. And I did forget to mention at the beginning, you need a preset vitals before you go to the lab to pick it up. So do not forget that, or they won't give you the blood. If our patient, say he needed to go to surgery and was just going to have an endoscopy and the surgery department didn't want to mess with the blood, you need to, and you just went to pick it up and they showed up 3 hours early to take him to surgery, you need to return that blood to the lab so you can use it again later after he returns from surgery. So if he's leaving the department or physical therapy to start working with him and they're taking him off the unit for an hour, you need to return the blood. Or you could start it and stay with the patient for 15 minutes, but you also have other patients you're caring for, so you can't